leadership is one of those things that everybody kind of has a different definition of what leadership is. I've read at least a half dozen books several times from John Maxwell, great leadership coach. His stuff is incredible. Of course, Jocko Willink is more of a modern day kind of leadership guy. And I follow a lot of his tactics and strategies when it comes to leading teams. But some of the things that I've learned over the years is that leadership does not have to be super complicated. Okay, so leadership to me is about, and if you take the leadership assessment that we have inside DSI, I talk about all these things. When you're leading a dental team, for instance, you want to make sure that you're very crystal clear about what success looks like for every position in your office. And everybody that sits in those roles has to be aware of what success looks like for them. There needs to be open lines of communication, empathetic and open communication. People have to feel as though they can approach you when something is going wrong. If you lead with a dictatorial or negative reinforcement type of leadership style, you're going to find that your turnover is much greater. It's going to affect your culture, and people aren't going to stay with you, and they're going to be scared to approach you and talk to you when they are struggling in their position. So, very, very clear expectations, open lines of communication. Accountability measures in place. So if everybody has agreed to, here's what success looks like for this particular role, here is what has to happen in my role in order for me to be successful and to be of value to the patient base and to the practice and to you, the boss, then there needs to be accountability measures in place. I love, our performance reviews that we do every 30 days, not once a quarter, not at the end of every year, not just when they're up for a raise, but every single month. And the easiest way to do that is to have some sort of assessment where you have 15 or 20 things that you expect them to do for their position, to be successful in their position. And they're going to rate themselves on a scale of 1 to 5. You're also going to take that assessment separately without them. You're going to meet and you're going to discuss the differences in what they think they are doing as far as their level of performance versus what you are observing as their level of performance. And it doesn't have to be a negative, confrontational conversation. In fact, typically, if you handle these correctly, it's relieving for them because they understand from your eyes where they are coming short. And then you could put an action plan in place to improve that particular area. And a lot of times, they give you some tips too. Like you could be a better leader if you did this or that. It's important that you go into those conversations, without ego and with an open mind and not getting defensive. To be able to take constructive criticism as much as you are doling it out, you have to be able to accept it. You have to be able to take it and give it as well as an effective leader.